Good afternoon, everyone. Today we are discussing a very important topic, that is pre-pregnancy counseling. Pre-pregnancy counseling is a golden opportunity for a future healthy pregnancy and, of course, a healthy baby. So when we talk about pre-pregnancy counseling, most of the times patients come to us only while they're about to get pregnant. However, all women of reproductive age, whenever they are if they plan to have a baby, they should meet their gynecologist at regular intervals. So the pre-pregnancy counseling starts with a key question. That is, what is the reproductive life goal of the woman? So every 5 years, it is recommended every few years, a woman has to think about her reproductive life goal. So she should address the question whether she would like to get pregnant or not. And if she is planning to get pregnant, does she want to become pregnant in the next year, in the next 2 years, in the next 5 years, or maybe later? Because that will determine how her treatment follows. When she comes for a counseling session, we take a detailed history. We will discuss what all the history will include. An examination, we prescribe certain investigations, and then there is a discussion once she comes back with the investigations and whatever her plans or her thoughts are regarding pregnancy. And finally, depending on when she wants to plan a pregnancy, a prescription is given. So first and foremost, like we discussed, all women of reproductive age should visit a doctor to discuss their fertility. It is also called family planning. And when we talk about family planning, we not just talk about planning a pregnancy, we need to talk about preventing a pregnancy, because around 50% of all pregnancies are unplanned, and unplanned pregnancies are seen to be at higher risk of complications than planned pregnancies. Also, of course, as we all know, teenage pregnancies are on the rise, and they can actually lead to a lot of complications in pregnancy, not just for the child, not just for the mother, but also for the child as well. So to avoid teenage pregnancies and to avoid inter-pregnancy spacing of less than 6 months. These are the goals that need to be met when we talk about family planning or pre-pregnancy planning and talk about contraception. The next and a very, very important discussion when a woman comes for pre-pregnancy planning is nutrition. So vitamin D supplement called folic acid needs to be started whenever a woman wants to plan pregnancy, 1 month before planning pregnancy and for the first 3 months of pregnancy. This decreases the risk of neural tube defects by around 70%. Some women, usual dose prescribed is 400 micrograms, but some women may need higher doses, like women with high BMI or diabetics or women with epilepsy may need higher doses. There's a trend, and in the market, we see a lot of multiple micronutrients where they come up with a few studies and say that magnesium works better or DHA works better, but none of this have been truly documented. The next is anemia. This is specifically important for developing countries, and especially countries like India, because the incidence of anemia in India is especially very high. So it is recommended for all reproductive age women to take a weekly elemental iron. So this is something that I don't think any of us follows, to take weekly elemental iron with 500 microgram folic acid. Also, deworming is, just give me a minute. Deworming is also recommended every 6 months to 1 year for all women. Because again, India being a tropical country, intestinal worms are a big problem and a major cause of anemia in young girls. Then continuing with the management of nutrition, optimal weight management is a very important factor before a woman decides to plan a pregnancy. It is advisable to attain a BMI between 28 to 23 kgs per meter square prior to conception, and healthcare providers should advise women about the measures to attain it. A bigger problem, especially in urban India, is about being overweight or obese. Obesity increases the risk of neural tube defects. Like we discussed, the women needs to take higher dose of folic acid. It increases the risk of big size baby, which can cause problems at the time of delivery. Chances of preterm birth, stillbirth, gestational diabetes, hypertension, thromboembolic disorders, all of these problems are increased as the weight increases beyond the normal weight. So the recommendations are that if a woman comes to us, who is overweight or obese, we emphasize on diet and exercise to lose weight before she becomes pregnant to avoid complications. To achieve a normal weight, normal BMI as much as is possible, because at any weight loss during pregnancy is not recommended. Yes, we can advise a woman to control her gestational weight gain or the weight gain during pregnancy, but weight loss is not recommended. If the woman's BMI is more than 32.5 kg per meter square, and she has comorbidities like hypertension or diabetes, it is recommended that she may go for a bariatric surgery. And a woman whose BMI is beyond 37, even without comorbidities, she can undergo bariatric surgery. For a woman who has undergone bariatric surgery, it is advisable not to plan pregnancy for the next 2 years, because that is a time of maximum weight loss and there is an imbalance of nutrients in the body. So if a woman has undergone bariatric surgery, for the next 2 years, she should not plan pregnancy. Some women may be underweight, and those who are underweight may have babies who may be preterm or may have low birth weight, or there may be an increased risk of birth defects. So for an underweight woman in an urban area, we especially look for eating disorders, especially young girls. They may have eating disorders where they just don't eat at all, or called anorexia nervosa, or they may have bulimia. And as a physician, as a treating physician, we discuss the need for a balanced nutritious diet. Next that we need to look for in a pre-pregnancy counseling, we look for chronic medical conditions. A woman who already has diabetes, whether just early diabetes, borderline diabetes, or established diabetes, she does need to definitely make sure that she comes for a pre-pregnancy counseling. Thyroid disease, heart disease, women with hypertension, seizure disorder, women who have had cancer or are on cancer treatment, women with asthma, any psychiatric illness, or autoimmune disorders like SLEs or rheumatoid arthritis. Women who have these or any other chronic medical conditions, they need a detailed assessment and discussion between the women, the neurologist, and the gynecologist, the specialist who is treating them, and the gynecologist, because first, she should be at the best of her health when she is planning a conception. Also, she and the family, the partner needs to understand the disease severity. There may be some conditions where planning a pregnancy may put her health at risk. So we need to understand what the disease severity is, and we need to review her treatment. There are some medication which may cause, which if taken during pregnancy, can harm the baby. So she needs to be on the safest medicine at the lowest doses that can control the disease. So In view of that, a review of current medication is the next step, so that to achieve the safest medical profile with optimal effective to lowest teratogenic potential. Teratogenic potential means lowest impact on the baby. So herbal products that are not required, they need to be tested, and women need to be educated to not stop. See, this is also important. She needs to be educated to not stop the prescription medicines without consult. A lot of women stop medication just before they plan a pregnancy, feeling that it may harm the baby. But sometimes stopping the pregnancy may cause more harm than benefit. So whatever medicine the woman may be taking, prescription medicine, non-prescription medicine, nutritional supplements, or herbal products, she needs to discuss with the doctor when she visits. Prescription medicines like ACE inhibitors, like NVAS, and a lot of the commonly used hypertension medicines. SSRIs are medicines that are used in psychiatric illnesses. For heart disease or high blood pressure, women may be on warfarin. Any pain medication or anti-seizure medicines need to be discussed with the doctor, with their specialist, as well as with the gynecologist. Then some women may be on some chronic medications like painkillers or analgesics, cough and cold medicines. Sometimes women are taking medicines for gastritis, for constipation, and even sleeping aids. All these medicines have to be talked to with the doctor, discuss with the doctor. Next comes the herbal and the vitamin supplements. As is with the trend these days, a lot of herbal products as well as vitamins and minerals are available in the market. We feel that any supplement is usually safe, but it needs to be discussed with the doctor, as some supplements like vitamin A supplements may not be healthy during pregnancy, and they need to be stopped beyond a certain time before actually planning the pregnancy. Next is infectious disease screening. In the pre-pregnancy counseling, there is a need for universal screening for HIV or AIDS, syphilis, which is a sexually transmitted infection, hepatitis B, hepatitis C, which if happen in pregnancy can be transmitted to the baby and cause problems to the newborn. Rubella is a mild viral infection, but if it happens in pregnancy, it has an 80% chance of causing anomalies in the child. So rubella is tested for all women. Varicella or chickenpox. If there is a positive history of chickenpox in the childhood, otherwise we screen for varicella also. Then toxoplasmosis. People who have pets at home, or especially cats, or who have in the habit of eating salads or uncooked food from the market, they need to be tested. They should be tested for toxoplasmosis also. Then there is a review of immunizations. First of all, and today's time, first is the COVID vaccination. Booster shot, 2 vaccines, and now the third also should be taken by all women who are of reproductive age, so that once they plan the pregnancy, it does not need to be taken during pregnancy, because it's although no studies have shown any adverse effects, but still we should try and avoid any medicines or injections in pregnancy as much as is possible, because long-term efficacy is still not being established. Next is influenza. Influenza should be taken every year for people who have low immunity, and just before planning pregnancy, taking influenza shot is also a good idea. Then hepatitis B. The awareness for hepatitis B vaccination is not there in India, but we need to review the status of hepatitis B, especially for all healthcare workers or people who may be exposed to blood or blood products. Then vaccination for measles, mumps, rubella also needs to be reviewed. Then varicella again for chickenpox vaccine, people who don't have a history of chickenpox. Then HPV vaccination is against cervical cancer. Young girls can opt for taking human papilloma virus vaccine or HPV vaccine. If it is not recommended during pregnancy, but if you have started a course of vaccine, it is better to complete it and then plan pregnancy. But if you are pregnant, then you cannot take it during pregnancy. Then other vaccine for women who may be have low immunity or maybe on some immunosuppressive drugs is pneumococcus. Then this is tetanus. Tetanus and Tdap is given for all women during pregnancy. Next is a review of family history and genetics. In the urban centers, we see the age of planning a pregnancy getting advanced. Every few years, right now the average age of planning a pregnancy in urban cities like Gurgaon is around 32-33. Ideally, the ideal age for planning pregnancy is between 20 to 29. And beyond 35, we see there is a sudden increase. There is a steady increase in complications as well as genetic problems during pregnancy to the newborn. So, advanced parental age needs to be taken into account. Consanguinity means when a couple marries inside the family. So there may be some genes which are shared and that can lead to a genetic problem in the child. So a history of consanguinity is also important. Then if there is a suspected or known hereditary disease in either of the parents or in the previous child or in any of the close family members, at least 3 generation genetic history is taken. In such a case, the patient is referred to a genetic counselor. Sometimes some testing, karyotyping, some chromosomal testing may be done for the couple. And actually, many a times, once the couple gets pregnant, the child may also be tested. But if once we know it, we can detect problems early in pregnancy. Then ethnic background. There are some conditions which are specific to ethnic backgrounds, like beta thalassemia is a common problem in North India. Similarly, with obstetric cholestasis, it's a pregnancy specific problem, but we commonly see it in India. So we have the ethnic background of both the parents is also reviewed. Next is substance abuse. Again, it's very important. I hope everybody knows that substance abuse during pregnancy can have serious and severe long-term consequences for the baby. So truthfully discussing the history of alcohol intake, smoking, tobacco, or any illicit drug abuse should be discussed with the doctor. Because any of these, if continued in pregnancy or just before pregnancy, can have a long-term impact on the baby. Another issue, which is again not commonly discussed in India, is domestic violence or intimate partner violence. So 1 in 3 women actually experience partner violence. And we need to discuss it, framing in context, like all women need to be asked this question. Next is occupational or environmental exposure. There can be home risks of pesticides, asbestos, and lead. And work risk related to agriculture. It is rare in urban India where most people are in desk jobs, but still agriculture, in manufacturing, and if you're working in factories, solvents, heavy metals may cause some impact on the pregnancy. In dry cleanings, some solvents are actually harmful. And in healthcare, some biology, if you're working in a laboratory or some problems, there may be healthcare problems like biology. Okay, so pre-pregnancy counseling is a very, very important primary preventive healthcare. It is done to decrease the risk of adverse effects on the health of the mother, the fetus, and the newborn baby by working with the women, so that we optimize her health, counsel her about wellness and health habits, address the modifiable risk factors, and provide information about healthy pregnancy. Thank you.